All right. Hello, ladies. How's it going? Happy Wednesday. Welcome to Wellness Wednesday. Hope you've all had a great day. It's been a pretty busy day for me. It's interesting as uh, we're moving into, this fall season. By the way, did you like that timer with the falling leaves and the red leaves and everything? I absolutely love living in Idaho because we get to see all the four seasons, and it's you just kind of get ready for the next one. Summer goes by, and then you're done with the hot, and then the fall starts, and I just love it. And Anyway, we're getting into the holiday season, and this topic that I want to discuss with you, this is a tough one sometimes during the holidays. It's a bit tough, but when we are resolved to really make our health our number one priority, and we are equipped with the right tools, then it becomes easier, and we can get creative. And so, of course, we're going to be talking about uh, gluten-free tonight. So we're going to start talking about that in just a moment. I do need to say my disclaimer. So anything that I say tonight during this Wellness Wednesday is just in health information and not to be considered health advice. Do not start taking, stop taking, or change the way you're taking any of your medications. If you feel like you need to, please first consult with your prescribing practitioner so they can help you do so and make the appropriate adjustments. Attending this Wellness Wednesday does not establish a doctor-patient relationship. So, awesome. All right. Well, why does gluten-free not work for thyroid problems and weight loss? That's the question. So I have heard so many patients tell me, that they've gone gluten-free and it didn't make a difference. Have you gone gluten-free and it didn't make much of a difference? Huh. So why is that? All right. I hear this all the time, and when we really get into the nitty-gritty, I think they understand the reason why it doesn't work. So in the master class, I speak extensively about gluten. Gluten is a large protein found in most grains, wheat, barley, rye, and several other grains. And other grains and even seeds can cross-react with a gluten-sensitized immune system, because the proteins are all very similar. And this all happened. So it started with because of monocropping, where you start growing the same things in the fields, and huge crop areas, and chemicals and fertilizers were added, and sprays, and this made it so that these poor plants were not doing well. They had to hybridize the grains, changing their genetics, making them more resistant to these chemicals, but changing the substance, changing the plant substance and the proteins. So the protein is changed, and it's so much harder to digest than it once was. And then you add to that wheat and grains are full of very high in fructan, which is a fructose. It's like a collection of fructose molecules in one kind of compound. Essentially sugar, right? Now our body does have the mechanism to break fructose down and convert it to glucose. It's a very biochemically expensive process. And so when your body lacks resources, when it's stressed, when it's dealing with, other things, you're going to have more difficulty breaking fructose down, converting it to glucose. And so then you get these gluten immune complexes that lead to, they circulate through the bloodstream, and they lead to brain and nervous system dysfunction, specifically dementia and neuropathy. You may have heard me talk about type 3 diabetes, right? Type 3 diabetes, which is insulin resistance of the brain. Well, what's the connection, Dr. Redd? I'll get to that. Gluten immune complexes also can cause skin issues like eczema, certain gut problems, joint inflammation, heart inflammation, like coronary artery disease. I mean, so many things. Studies actually even show that up to 100% of us have gluten sensitivity to some degree. And this is important. I shared in the masterclass that antibodies from gluten can circulate for at least 90 days. And I have learned that they can even circulate up to 1 year's time in our bodies. So for those of you who said that you went gluten-free for a month or 2 months or even 3 months and nothing really changed, well, I'm sorry, but if you're sensitive to gluten, you're not going to necessarily notice any positive effects until it gets out of your system. And that can take months and months and months. Now, when most give up gluten, they turn to gluten-free foods and compounds that are these are foods that are full of, loaded with starches, grains, and hidden sugar. So why is this important? And this is why I say gluten-free doesn't work, right? Gluten-free meaning those foods that are labeled as such. Now, when you really are gluten-free and grain-free, then you can get somewhere, okay? So these foods are, they're going to cause blood sugar to rise and then insulin to spike. And then insulin surges trigger autoimmunity. So now if you remember that 90 to 98% of low thyroid cases are caused by Hashimoto's, you can begin to understand why a gluten-free labeled diet didn't really make a difference, right? Because the insulin's going to trigger the immune system to attack the thyroid and potentially other tissues, because once you develop one autoimmune disease, you're likely going to develop multiple autoimmune diseases and even cancer. So that is the problem there. And insulin's going to trigger, and these insulin surges are going to trigger the immune system to attack. So when you have food labeled as gluten-free, they contain these grains, and they will absolutely cause insulin to spike. Now, if you're having trouble losing weight, it's because these foods cause blood sugar to rise and insulin to spike, and they will cause weight gain, not loss, right? If you look at the labels, you're going to see that, and we're going to look at a few here in just a moment. You're going to see what I mean. In fact, a lot of times the carbohydrate count is higher in gluten-free labeled foods than the gluten-containing versions. And this is why I've heard a lot of patients, a lot of women here in the group share that they've tried this. They've gone gluten-free and they really didn't get anywhere. And so is it because you've been just switching to eating foods that are labeled gluten-free? I talked recently with a prospective patient who told me that she really felt she was going to have a lot of problems with going, gluten and grain free. And she's gotten used to, shopping the gluten-free, aisles at the stores. And and she just was not ready. I didn't actually accept her as a patient because she wasn't ready to really make trying to eat gluten and grain free a priority. And I knew that if she did, she would be successful. But I don't accept patients when I don't think they're going to be successful for any reason. I'm not interested in that. But I also spoke to another patient, and her name's Tanya, who has been very successful, even though she is super, super busy with work, and says once she told me once she started planning and getting creative with eating this way, she feels it is easy to eat the way she needs to eat, and she's more energetic now. Her brain fog is much less, able to focus better and remember things better, for especially as related to her work. She is sleeping better, and she has released 56 pounds altogether. So, ladies, we really have to look at these labels. So let me pull that up. I'm going to share my screen, and we're going to look at some labels together, and we'll see what these gluten-free foods are looking like. So give me 1 second. So this first one, we can see, check the ingredients. Cornstarch, potato starch, rice flour, corn fiber. Then we have palm oil, salt, sugar, cellulose gum, soy lecithin, sodium bicarbonate, yeast extract, which is a fancy name for a preservative and flavor enhancer, sodium acid pyrophosphate, and citric acid. So, I mean, I can pronounce those, but I don't know. We always say, well, if you can't pronounce anything, don't eat it. We really want to take a look at these starches. These are going to have as much sugar and carbs. Check out the label over here on the right side. So it says that there is, let's see, total carbohydrates, 20, is it 24? It's kind of small. Let me see if I can blow it up a little bit for me. 22 grams of, nope, that's not it. I think it says 24, but that's a lot of sugar, a lot of carbohydrates. And then it does say 1 gram of sugar, and you're like, well, Dr. Redd, if it only has 1 gram of added sugars, then why is that so bad? Because those other carbohydrates, ladies, are going to spike your blood sugar, and that's going to in turn spike your insulin. And that's going to bring, yes, it may bring your blood sugar way down, but having that wide swing is definitely not conducive to weight loss. And this happens over and over and over again. And you then start to keep your blood sugars higher. Insulin's not working as well for you. And this is how you develop insulin resistance and diabetes. So this is the main mechanism as well for weight gain, because insulin is simply going to put excess sugar and carbohydrate, glucose from carbohydrate breakdown, into fat. Okay. All right. So let's look at the next one. And I may have to change how I do this because I'm not sure I can see this very well. So we've got ingredients for this gluten-free bread, and it's got water, tapioca starch, brown rice flour. Then we've got canola oil. We know we've got to stay away from that stuff. Egg whites, cane sugar, tapioca, and maltodextrin. And I'll say something about tapioca and some of these. For some of us, that may be fine, but that can even cross-react. Remember when I said that some of these some of these grains and things and grain substitutes, they can cross-react with gluten or with the immune system and be just like gluten to the body. Okay. Let's see what else does it have. It has tapioca syrup. Then we have sorghum, flour, rice starch, yeast, apple cider vinegar. I mean, ladies, you get my point. There's a lot of stuff in this label, and you may have to blow that up on your phone for you to see it. Overall carbohydrates, 22 grams per serving. That's in 2 slices. So if you're using that to make a sandwich and so forth, then you're going to have almost as much sugar as you do in a regular piece of bread, carbohydrate. And 3 grams added sugar there. Again, Dr. Redd, what's the deal? These foods are going to raise your blood sugar levels and cause insulin to spike. And the more insulin you make, and your pancreas doesn't know how much you're going to eat. And so it often overshoots so that it is sure to get your blood sugar down. And then you start getting into this cycle of too much insulin. And the more you make, the more resistant to it you become, and the more weight you're going to gain. Okay. And then the final slide I'll show you. And we can see that this gluten-free pasta, and this is labeled as not, you can't see it on this label, but it is described as non-GMO grains, right? It's got to be healthy, right? Non-GMO is much better than these GMO type grains and corns and things like that. But if your goal is to lose weight, if your goal is to have less brain fog, less cognitive issues, better memory, better focus, then these are not your friend. And these are not going to help. These foods, these grains are going to spike insulin and potentially lead to type 3 diabetes, which is insulin resistance of the brain. So ladies, got to look at these labels, right? All right. So there's a couple of books that I definitely recommend to you if you haven't heard of them. Grain Brain by Dr. David Perlmutter and Wheat Belly by William Davis, both MDs. They have done the research. They have looked high and low at what these foods do to our bodies and why we are sensitive to them. You don't have to suffer with this extra weight or these symptoms of depression and anxiety, which a lot of times, as far as depression goes, this is a cellular depression, cellular energy lack that causes you just to not be motivated because you simply don't have the fuel in your cells to burn, or that you can't burn the fuel because of toxins. You have to understand the lies in the food industry, and then you need to have extra resolve, I guess, sometimes to stick with the changes you're making, simply because now you understand that these foods, the effects from these foods can stay in your system for so long. Often you have to change the way you're thinking about food, thinking about, it's not about not being able to eat it, it's choosing not to eat it. Stopping to consider too that food should be medicine and fuel, okay? Well, because it is. It really is what it should be. And I like food just as much as any of you. I like good food, and there is a lot of good food. Now, in the masterclass, I dive really deep into this and look at why these foods are inflammatory, especially gluten, why it's literally one of the most inflammatory foods that we could put into our bodies. And if you are willing to think differently about it and put some different pictures into your head when it comes to choosing to eat gluten or even these gluten-free foods, because as I've told you tonight, gluten-free is not the way to go. Now you know what I mean, right? And you need a doctor that understands all these moving pieces, who can identify which triggers are making you sick, then show you exactly what to do every step of the way. Okay. I'm going to leave that there. If you have any questions, I will cover a few questions. Let's see what we have. All right. So one question is, what about wild rice? Oops. Let me try that again. What about wild rice? It is a grass. And I mean, technically, it's still a, I would have to argue the point that even though it's considered a grass, you're probably okay, but it's probably going to be, it's going to act like a grain. That's really what it does. You're going to, eat it and try to digest it, and it's going to have a certain amount of carbohydrate that is not all fiber. All right, and that's going to have to break down in your system, and it's still going to have carbohydrate that will raise blood sugar some and insulin. So if your goal is truly to get the weight off, improve your energy, decrease the brain symptoms, then it's still probably not a good option. And then, so then someone has a question about, what about the palm oil? So palm oil is not considered one of the more healthy saturated plant fats and oils. And I would stick mainly with olive oil, extra virgin olive oil, avocado oil. Some coconut oils is okay, but I wouldn't have that as the majority, use that the majority of the time. Palm oil is going to have too many of the omega-9s, omega-6s that do not work as well in our bodies as omega-3s. The next question is, how much almond flour baked goods can you eat that will not be too much? These only have legal products included. I'm not sure what is meant by that part, but the first question, it's really hard to answer because everybody needs to really have a customized dietary plan. Sometimes people will eat too much almond flour products, and some people can have, almond flour products. For some people, those will still raise your blood sugar because almond flour is concentrated and it still has carbohydrate in it, very, very little, but some. And because of the way our body treats this protein, it's basically protein powder, if you want to really get down to the nitty-gritty. Our body's going to use that to make sugar, and that can raise your blood sugar the next day. Okay, too much proteins can raise your blood sugar the following day. You might even get lucky and it raises it that same day. But then that's going to cause insulin to spike as a result every time. Now, again, some people are able to process the almond flour products, baked goods, just fine. But also keep in mind, what are they sweetened with, right? So if you're sweetening it with monk fruit or maybe like coconut sugar, this may be too much and cause you to spike insulin. So it is very much an individualized process. Okay. Have you read Super Gut by William Davis? My chiropractor advised me to get it. That is one I actually haven't picked up. So I might have to. What about non-GMO organic corn tortillas? Corn is a grain. Simply put, it doesn't matter if it's non-GMO, GMO. If you're trying to lose weight, corn is not ever going to be your friend. It will cause blood sugar to rise and release, you will spike your insulin. Okay. Popcorn too. Popcorn too. And what exactly is non-denatured whey protein? Okay, so whey protein is processed, and it is in the process, it is denatured, meaning it's treated with high heat to basically break down the protein, change it. Unfortunately, when whey or soy and other proteins are treated this way, the denaturing process changes the structure more so that our bodies can't digest these proteins as well. Well, non-denatured whey is when that process, it hasn't gone through that process, treated at very high heat. You're still going to have trouble digesting it because whey is a protein that our bodies do not fully digest. So that's potentially a trigger, especially if you have autoimmune disease, and it's going to potentially cause inflammation of your intestines and leaky gut. So it's often that is why I say get rid of dairy too. I mean, I talk a lot about that, a lot more about that in the masterclass. And then this question, is almond milk in shakes better than coconut milk? Not necessarily. Both are fairly low in carbohydrate. So they're generally both good choices. All right. If we don't have any more questions, I will leave it there. Remember, oh, maybe one more. If you do have any other questions, post them in the comments under the video, and I can get to those as soon as I have the time to do that. And so, ladies, remember that if your goal is to well, maybe. Okay, there is one more question. I'll answer that. Where should we be getting our olive oil from? California or Mexico would be the best sources. Possibly Spain. I just know that the Italian olive oils can be tainted. Oftentimes in testing, they have been tainted with other oils to cheapen them and help them make more money. So it's best that you stick with California or California olive oil is probably going to be your best bet. I'm thinking of actually avocado oil when I say Mexico. So avocado oil, if it comes from Mexico, is probably good. If it comes from California, it's good. And it needs to be cold pressed if possible. Organic's always best. And that's the most important. The extra virgin olive oil, cold pressed, minimally processed olive oil. Okay. All right. So, ladies, remember, if your goal is to lose weight, remember gluten-free doesn't work. Gluten-free in the sense of gluten-free labeled products, but actually going gluten and grain-free is going to help you the most. Remember that there are answers. You don't have to be suffering with these symptoms. If you can find the answers, you can find the root causes, and Often it's getting the right testing that will help you find those root causes. That is the only way to find the root causes for what you are dealing with. And remember that you still have the power to heal. Thanks for joining me for Wellness Wednesday, and have a great evening, everyone.